Next tonight, it takes more than 3 months for a third of women to get a correct diagnosis of ovarian cancer after first visiting their GP. That's according to a new report.
It also found that most people don't know the key symptoms of ovarian cancer, leading to slower referrals. Now there are calls for better education for women and doctors alike in the hope it could save lives. Amrit Birdie reports.
Becky Gray from Warwickshire found out she had ovarian cancer at the age of 47. In the time it took to correctly diagnose her, the cancer had spread and was at an advanced stage. Like many other women, she had no idea she was experiencing symptoms linked to ovarian cancer.
When I retrospectively look back at some of the things I was having going on that I'd put down to perimenopausal symptoms at the age of 47, were actually more sinister and could have been looked at that point, and that my cancer diagnosis could have been made. Awareness is very lacking, I think, and I'm a healthcare professional, and I feel I should have been aware of the signs and symptoms of ovarian cancer, and I wasn't.
New research by charity Target Ovarian Cancer shows nearly a third of women are waiting more than 3 months from first visiting their GP to getting a correct diagnosis for ovarian cancer. They also found a lack of knowledge around symptoms is impacting the diagnosis rates. Anyone with ovaries can get ovarian cancer, but the symptoms aren't always obvious. They include frequently having a swollen tummy or feeling bloated, pain in the tummy or between the hips, no appetite or feeling full quickly after eating, an urgent need to go to the toilet or needing to go more often, and things like back pain, feeling tired or losing weight without trying.
We've got an awareness crisis in ovarian cancer. Currently just a third of women are diagnosed at an early stage when ovarian cancer is easy to treat. So quite simply, the earlier it is caught and the faster it's caught, the much easier it is to treat and better outcomes will be.
The Department of Health and Social Care say they are improving care for cancer patients across England, including by opening more than 80 community diagnostic centres which deliver vital cancer checks. But those who treat cancer patients day in, day out say the push for education must also stretch to medics if further progress is to be made.
For GPs and also practice nurses, physician associates, all the people you might see in general practice, we need to improve the education and the index of suspicion, so we're more activated to pick up on symptoms and to follow them up more at an earlier stage.
NHS England say £2.3 billion is being invested into expanding diagnostic capacity for cancer, as well as funding for a new ovarian cancer clinical audit, in the hopes of improving outcomes for patients across England. Amrit Birdie, ITV News.